Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in the Pioneer Valley. And in the area of healthcare, we know that those living with and being affected by Alzheimer's continues to increase. It's a challenging and difficult situation, but it also means that we have to continue to focus on providing greater levels of services for individuals with Alzheimer's and also raise money for the research to address it. So I'm very happy to welcome to the program someone who's very focused on that here in Western Massachusetts. She is Bianca Walker with the Alzheimer's Association.
Thank you for having me.
Bianca, it's a great pleasure having you on the program.
I appreciate the opportunity.
And welcome to the Berkshires.
Thank
because
you.
I know you're relatively new to the area.
Yes,
Although, how
I
long
am.
has it been since you've been working?
Oh, gee, so this is going to be my third year
Okay.
coordinating a walk, but that's still relatively new considering.
I know. Well, you know, if you're not born in the Berkshires,
Right,
you're,
right.
But that's the way it goes. But of course, and we cover all of Western Massachusetts.
Awesome.
So individuals will be watching this program in the Pioneer Valley as well, where you also do
Another
a great
walk.
deal of work. Another walk.
Yes.
So yes. So when people think of the Alzheimer's Association, that annual walk is one of the things that is one of your key
Absolutely.
key initiatives. And so it used to be called the
Memory
Memory
Walk,
Walk, and it
yeah.
changed to the Walk to End Alzheimer's
Yes.
because I think there's a good reason behind that.
Absolutely. Walk to End Alzheimer's because that's what the support is for. Eventually, we do hope to end Alzheimer's, and it's a lot of the support that we receive from the community that helps us raise funds for the walk that will help us achieve that goal.
So tell me about your role a little bit.
Sure.
And about the Alzheimer's Association. It's a nonprofit
Yes.
that works with partners in healthcare. And so, tell me about your role and what
Sure.
it's like.
What I do is I coordinate all of our fundraising initiatives, primarily the walk. I just actually had a Reason to Hope breakfast in the Springfield area where it was an ask event, just raising awareness about our cause and focusing more so on our research. But I coordinate a walk here in the Berkshires. It's held in Cheshire on the Asherville to Cook Rail Trail, and this year it's going to be held Saturday, September 19th. And the second walk I coordinate is in Pioneer Valley in Holyoke, and that's going to be held on Sunday, September 27th. So they're a week apart.
So, of course, you're working at, there's the walk, which is one day a year.
Yes.
But, of course, a lot of that means having members of committees,
Yes.
having different sponsors
Yes.
commit to this because, that's a big part of raising dollars. But then, of course, the individuals, I think, who tend to be most passionate about this are people who have had family members
Absolutely.
who have suffered from
Absolutely.
Alzheimer's in years past. So it's kind of a combination of that energy coming from different places.
It's a combination of both. And what we find sometimes, folks hear about our association by the walk, and they don't really know that there are programs and services also available to them. Many of them are caregivers that they can take advantage of all free of charge. So it's reciprocal.
And so tell me about that a little bit, because when you get a diagnosis of Alzheimer's, and of course if it's early onset, I think it can be even that much more
Devastating.
traumatic and devastating. And of course there's a recent film with Julianne Moore highlighting that, which I think will bring a greater level of awareness to it. But with that said, generally speaking, most individuals who are suffering from dementia and Alzheimer's are the mothers and the fathers of baby boomers, that sort of
Absolutely.
thing, people in their 70s, 80s,
Yes.
and older than that. But when that happens, all of a sudden you're thrown into this situation.
Right.
And the way I describe it in healthcare, I've described it as sort of a Wild West because generally people don't necessarily know what the first step is. So take us through that a little bit.
Absolutely.
What should people be thinking about?
So a lot of times what we've been seeing, unfortunately, is folks receive a diagnosis from their physician and they hear come back in 6 months. Well, a lot of things can happen in 6 months and they really don't don't know where to turn. So that's where the association can come in to make those connections for folks. We provide free care consultations just to help people assess what they should do. Who should they be reaching out to? What connections should they make? What conversations should they have internally within their own families to make sure that their loved one, receive the right services, but they come up with a plan on how they're going to move forward so that it's a devastating diagnosis, but so that they're prepared for it.
Mm-hmm. And so you have that, but of course, now thinking about that,
Right.
one of the initial challenges that you have is that first diagnosis,
Right.
actually. So at some point, a physician
Right.
or some sort of clinician, but generally a physician,
Right.
needs to make that diagnosis
Right.
to begin with.
Right.
And from what I understand, that can be a challenge right from the very beginning, is getting that diagnosis.
Getting that diagnosis, we're actually working on legislation right now so that a law can be passed so physicians educate their patients on the fact of if they see something wrong, they don't hold it in. Sometimes I've heard many stories where, oh, we didn't want to worry them. Well, we appreciate that concern, but it should not be up to the physician to hold that information to themselves, and it's really up to the family. Well, the family really needs to know that this diagnosis is something that they're going to be dealing with so they can take the necessary steps to prepare the families and the loved one for what the journey they're going to be working on.
It's interesting because you hear our friend and colleague Dr. Paul Solomon from the Memory Clinic, and he's said
We love
this
them.
many times. Yeah, I love him too. Good guy. And talking about the difference between memory loss that is expected when people
with age. Yes.
and the difference between that and what Alzheimer's is,
Absolutely.
or dementia. And there are some, there's some gray areas there, but there are also some distinct differences. And again, that's what we're talking about.
Right.
Because again, if a physician is looking at a situation and saying, yes, someone is aging and becoming a little bit more forgetful,
Right.
that's forgetting where you put your car keys,
Right.
is far different than someone who
Doesn't recognize what the keys are.
what the keys are.
Right.
And so that difference, that very well. But again, I think the general public needs to have that education, but even physicians.
Absolutely.
And so what you're asking for physicians, once that diagnosis is made, first of all, they have to be educated to know the difference.
Right.
But then when that does come, that they need to communicate that, because there are better ways of treating Alzheimer's today.
Absolutely, absolutely. And then also, if there's a conversation that needs to be had with the family once that diagnosis is made, and we as an association are prepared to take on folks and have that necessary conversation with them and guide them in the right direction so that the burden of what to do next is not on their shoulders.
So tell me about the dollars raised through the Memory Walk, and we talked about the combination of we talked about Paul Solomon. He's one of those guys doing some significant research into potential vaccines for Alzheimer's, but that's part of it. And then there's also providing a greater level of service for individuals with Alzheimer's. So tell me about dollars being raised out of Berkshire County and the Pioneer Valley. And where do those dollars, what are they used for?
Well, I can't commend Berkshire County and Western Mass as a whole for the amount of support that we receive. Last year, between the two walks, we raised more than $250,000 here in Western Mass, specifically in Berkshire County. We raised $110,000, so that's significant.
And we're a much smaller population.
A much
than
smaller
Pioneer Valley,
population,
so.
but right on the heels of many of the other walks that we've had around this state. So I'm very proud of what this community is doing to support our efforts. The money raised helps us fund our programs and services, but more importantly, our specific association is looked upon across the nation as a leader for what we're doing in regards to research. We allocated $10 million to research right here in our state. In 2010, the #1 goal of our National Alzheimer's Protection Act was to treat or effectively cure Alzheimer's by 2025. And if you think about that, that's about 15 years from now.
Yeah.
So that's an aggressive goal that we have to achieve, and with aggressive goals, we need aggressive funding. So that's where all the funds that are raised from the walk is really going, to make sure that we are on track to hopefully change the trajectory, excuse me, of this terrible disease.
And actually, it's interesting because, looking at this, and this is, I'm not the first to say this, but looking at the number of people being affected and potentially impacted in
Right.
their lives with Alzheimer's, and those families that would be dramatically impacted, the number of people is so large and only growing. You compare that to the dollars being put into research,
Right.
comparing it to other diseases,
Right.
for instance, like cancer, which of course
Right.
we want as many dollars going
Absolutely.
there as well for
Absolutely.
research to find groundbreaking treatments for all diseases, we hope. But right now, I think it seems like there's a bit of an imbalance there. And again, I'm not the first to say this,
Right.
but so part of it, I'm sure, is advocacy to say, okay, we're raising dollars to provide money for research, but also perhaps that support will also leverage more public dollars, and other dollars to go to this, because it can't just be private fundraising alone.
Absolutely, absolutely. And I can say in the state of Massachusetts, we're blessed by receiving support from our congressman and our senators to help us pass these bills. And unfortunately, there is an imbalance, but right now we're in a position where that's changing, and bills are being passed, and funding is being provided. So hopefully, as I said, we can really get more aggressive in the dollars that we're allocating to research, so that by 2025, that goal can definitely be achieved.
And it seems to me that from a cost-benefit analysis standpoint, looking at it, to raise a significant amount of dollars to get to a point, again, some real breakthroughs have been made, but to get to that point where if we can possibly find the right mixture to make a vaccine,
Right.
to get there,
Right.
the cost implications is huge, because to treat someone
Right.
for several years with Alzheimer's and with dementia, whether it's a progressive situation going from home care maybe to some light assisted living, and then to undoubtedly at some point a secure unit in a
Right.
nursing facility.
Right.
It's extraordinarily expensive
Right.
to provide that care.
Absolutely.
So to be able to
Fund that.
address that and fund that
Absolutely.
can have a huge positive cost implications for years to come.
Absolutely, absolutely.
So we're on the right team then.
We are on the right team.
Let's do this. So tell me about the Walk to End Alzheimer's, specifically in the Berkshires.
Sure.
What are you looking for? Certainly have partners who have been a part of this for a few years, and probably some new ones that have come on board.
Absolutely.
Since you've been involved.
I'm
But,
very happy from the support that we're receiving in the community. Berkshire Health Systems is one of our largest sponsors. Adams Community Bank, the Memory Clinic, Home Instead Senior Care, and a wealth of other exhibitors really come together to bring the awareness to the cause. Of course, fundraising is extremely important, but sometimes I feel like awareness is just as important, awareness of the cause, but awareness of the programs and services that are available to folks as the diagnoses are being made. I had a conversation with someone just yesterday, and she said, we really have to do something because it's going to be an epidemic, and it truly is if we don't do something now about it.
And of course, with that said, we have people who are suffering with Alzheimer's and dementia today.
Yes.
And so, to support those services that are out there, and a lot of the people who are also members of, your committee and
Yes.
and who have committed time, energy, and dollars are those people in the area of senior care.
Absolutely, absolutely. We have representation from Kimball Farms and Porchlight, and I can go down the list. So they really do come together, receive support from the Berkshire Alzheimer's Partnership, which is an entity of the Alzheimer's Association of caregivers and volunteers, and the representation from the assisted living that really helps us make referrals in the community and educate the community on, what are the 10 warning signs, or if you know someone, have them call the association to get the care consultations, or to get the what plan would work best for them. So it's really the community coming together as a whole to bring awareness to the cause and to also help us raise funds.
Now, I don't want you to go through all the 10 warning signs, but generally speaking, you are, you have a family,
Right.
you have mom or
Right.
dad or loved one. What are some of those things
Absolutely.
for people to sort of just be aware of,
Right.
when it comes to identifying the possibility of Alzheimer's and
Absolutely.
dementia?
Something that I would say is if you have a loved one who used to be a social butterfly, likes to go out in the community, likes to go to bingo every Wednesday, and all of a sudden they're behind the blinds and they don't like to socialize as much, that could be a cause for concern. Or as we mentioned earlier, it's not the fact of losing keys, because I lose my keys every day.
Yeah,
But if you have your keys in your hand and you don't recognize what they are, that's a cause for concern. If you're very good at balancing your checkbook, sometimes that could be a sign or not a sign. Some folks aren't. But
But if you were before,
but if you were before
and
and
suddenly
now
you're not.
you don't know how to do that, that could be a cause for concern. So it's everyday things that you used to be good at, but you notice small things are changing. It's just really a conversation initially to be had with your physician. I'm noticing some things. Let's discuss whether or not this is a possibility for me.
And so, in a sense, again, not necessarily the memory aspects, more behavior,
It's more
in
behavior.
a lot of ways.
Absolutely, absolutely. You notice just general behavioral changes within a loved one, or if someone used to be very well put together, and there's some grooming issues taking place, or if there's issues in the house, they used to know that recipe by the back of their hand. They used to cook it for 25 years, and now they have to look at what the actual ingredients are, and they're just forgetting, what their favorite recipe are. It's really just small things that you just have to be aware of, and notice occurring with your loved one.
And so, you do maybe notice some of those changes and maybe some of the behavioral changes. We talked about the whole physician, aspect, but the Alzheimer's Association itself, I assume, is a resource. You have a robust website.
Yes.
No doubt about that. But again, you also have support services, I believe, for people to make a phone call.
Yes.
And maybe talk to one of your experts.
Yes, and that is a 24/7 helpline. If you're a loved one, if you're a caregiver and you're stressed out by a loved one and you don't really know what to do or where to turn to, or if you just received a diagnosis and you have a lot on your chest and you want to get it out, we are there to have these conversations with folks 24/7. I can't guarantee that I'll answer the phone at midnight, but again, someone will be there to answer your question.
But you do that yourself personally.
No, myself
Okay,
personally.
I was gonna say because you're pretty busy to be manning the line.
Unfortunately,
Okay.
but we do have a program manager in our office that handles our care consultations. But there's always someone available, and I'd be more than happy to give that number. It's 800-272-3900, and again, that number, call it any time for whatever reason. If you have a concern, if you have a question, if you just need to talk, that's what we're there for.
And the website is very simple,
Yes, www.alz.org.
right? Okay, and I know there are ways then to click through to your region.
To click through to our region, then you'll get our specific programs and services offered in our Mass New Hampshire chapter.
Okay, so very simple website, alz.org. And so, in your experience, what makes Berkshire County a little different, and I think I would say special, because again, if you look at per capita,
Oh, absolutely.
and the dollars that we have been able to raise, and of course you've worked really hard to help that along
Absolutely.
with your committee to be successful. But interestingly, to see just the sheer number being raised from such a small population, that's really special. So what is it about Berkshire County that makes it so successful?
I think the togetherness of the community. There's a lot of passion here, and it's just very family oriented. Not that everyone is related by blood, but it's just a family oriented community, and I'm very proud to say in the state of Mass, our fourth largest fundraising team was right here from Berkshire County, helped us raise $28,000 last year. That's significant. That's like awesome.
Yeah, and that's again fourth in sheer number.
Absolutely.
We're not breaking down per capita
Right,
or anything
right.
like that. And actually, we probably performed very well. If you did
If
break
you
it down,
did break it down per
per
capita, yeah,
capita.
it's just amazing accomplishments and just amazing support is coming out of Berkshire County, and I can't thank the community enough for the support that we are receiving. I like to say, you know, when we do get a diagnosis, all of our supporters, pat yourselves on the back for making that happen and know that you helped make that happen.
And so tell me about yourself a little bit.
Sure.
Your evolution in your career, which brought you to the Alzheimer's. You said you've been in this region for 3 years.
3 years, yes. And prior to, I was with another nonprofit for 12 years in the same role, raising funds. I don't know, I like asking for money.
Wow. That makes you very valuable. Yeah, it's interesting because there are a lot of people who feel uncomfortable.
Yeah,
with that. But when you're passionate about something,
I think that's what it is. When you're passionate about the cause and you really, you know, I can't speak very highly enough about the credibility of the Alzheimer's Association. It just makes my passion that much more and just makes me want to do that much more. I really am honored to be a part of this association. It's really the top down, just everyone is really working very hard, from our CEO to our volunteers to our program staff. It's really, again, another family oriented organization that I'm just truly honored to be a part of.
And Alzheimer's Association is nationwide.
Nationwide, we are part of a national organization, but again, very community oriented. Our chapter here is Mass, New Hampshire, and we're 35 years old this year. Yeah,
that's amazing.
Yeah.
Because I think it was 35 years. We were talking about in the 80s when we were actually just starting to understand
Right.
Alzheimer's
Right.
Existed.
Absolutely.
And I think it was during the Reagan administration. Of course, ironically, in a way, he
has
of
it.
course suffered
Right.
from it and ultimately died with Alzheimer's progressing pretty dramatically. But it was during actually I think the Reagan
Right.
administration that we even just started to understand
Understand it.
Alzheimer's.
I
So
think
you were 35 years is right around that time.
Yeah, I was just born. But yes, our chapter was one of the founding supporters of the national organization. So that's another proud accomplishment that we have right here. There's just a lot of great things coming out of the state of Massachusetts that we should be very proud of.
And so you break it up into regions that way, and then there's a CEO at the very top.
Yes.
And then you must have regional sort of.
Yes, we have several regional offices. Our Springfield office, of course, then we have a Worcester office. We have an office in Raynham, and then our headquarters is in Watertown.
So that's the regional headquarters?
Yes, that's our regional headquarters.
And is there a nationwide headquarters in Chicago?
Yeah.
Okay.
Yeah.
Okay. So that's where it is, and it's interesting. Chicago tends to have a lot of conferences
Right.
regarding Alzheimer's.
Right.
I know our own Dr. Solomon has been involved in a few of those conferences out in Chicago, not necessarily put on by the Alzheimer's
Right,
Association,
right.
but it seems to be a center of this knowledge and
Great
research
work
happening.
coming out of, yeah, absolutely.
So we hope it continues. So what would you ask, of those businesses out there who may be watching this, who may be considering, their budget, for the year,
Absolutely.
and know that they do, generally will give to nonprofits, and you're out there trying to fight for your own cause for
Absolutely.
that, businesses and also individuals, and many of them probably. Again, like we said, affected by Alzheimer's, their families have been impacted. So how can they get involved?
There's many ways you can get involved: through sponsorships, exhibiting at the walk, through volunteering. We're always looking for volunteers, and I think it's a great workplace movement to pull your employees together to support a great cause. We're always looking for teams to be formed. So there's what I say is, where there's a will, there's a way. You can sponsor, you can form a team, you can volunteer, you can help us coordinate the event by coming onto the committee. So we're really looking for support in whatever ways the folks are willing to give it.
And so how can people get in touch with you?
Absolutely. My direct line is 413-787-1113, and my extension is 2152. Or if email is more convenient, bwalker@alz.org, and I'll circle right back with you.
Wonderful. So, like I said, you've done a tremendous job here
Thank you.
in the Berkshires, very successful in raising important dollars, for the cause.
Thank you.
And again, just about every family on some level, extended or otherwise, has, I believe, been affected by Alzheimer's. And so it's not, you don't have to go too far to find individuals who have
Someone
been,
that's affected.
yeah.
And that's another thing I would say to the businesses, just ask your employees, are you affected with this disease? And I guarantee you at least one would say yes.
Indeed, indeed. So, Bianca Walker, a great pleasure
Thank you.
having you on the
I
program.
appreciate the opportunity.
I look forward to seeing you again.
Yes.
I know you're out and about and very active.
Thank you.
And actually, as we're recording, Bianca is going to be on her way to a nonprofit showcase
Yes.
right in Pittsfield. So, very, very busy, and I appreciate your energy
Thank you.
and your commitment to the Berkshires.
Thank
So,
you. I appreciate it, John.
thanks for coming on
Thank
the
you
show.
for having me.
I appreciate it. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.
Thank you.